One of the challenges about treating colorectal cancer today is that treatment's rapidly evolving, and there are so many variables now that inform why we do what we do. So no longer is it just the location of the tumor and the clinical stage that might determine what therapy to give or how to sequence your therapies or what kind of surgery you might need. When you're at a place that has access to not only advanced imaging, advanced colonoscopy and endoscopic techniques, tumor genetic information, but also researchers who are involved in all of those areas and who are on the cutting edge of developing these new algorithms and new techniques, it opens so many doors for the clinical care that we can provide. At Siteman, we've put together a program that is trying to streamline care for this group of patients because it is so different than the standard 60, 70, 80-year-old who's getting a colorectal cancer.
The Young-Onset Colorectal program was implemented because there is actually a rise in incidence for people who are diagnosed with young-onset colorectal cancer. The younger generation, for some reason, seem to have an uptick in cancer diagnosis, and we're not really sure why. We need to help these patients not only be aware of this cancer diagnosis, eliminate the stigma, but we have to account for everything else that's going on in their lives, their children, their work. And so we created this program specifically for them so that they can come in, be treated, still live their youth, and feel like a normal person.
I was diagnosed with colorectal cancer actually almost a year ago to the date. I started having the typical colon cancer symptoms: constipation, change in bowel habits, bloating, back pain. I called the doctor right away, got a colonoscopy scheduled. Immediately they jumped in and had an MRI, CT scan. They confirmed that it was stage 3 colon cancer. The thing that was the most impactful was just how quickly everybody moved. I was diagnosed on August 18th. By September 12th, I had a chemo port in. By the 23rd, I was getting radiation, and by October 10th, I was getting chemotherapy.
It was a great pleasure to work with Meghan throughout her journey of cancer care, which is still ongoing. I found her to be very engaged in her care. She always had a big list of questions, and I think that engagement, that involvement really helped me care for her better. I got a sense very quickly of what the things were that were important to her and how I could change her care, her dosing, her scheduling, all the little things that go into taking care of somebody with cancer, how I could change those things to better serve her.
I think that's the thing that I really was thankful for, is that nobody was lollygagging or, it was treated with such urgency. The doctors made time to answer questions that I had, and they really treated it like it was their fight too. I knew that they were in it with me the whole time. As far as having cancer goes, it was a great experience.
What drives us to do what we do is being able to not only take care of patients, but also to see the rewards of what we do in the outcomes of the folks that we treat. For a surgeon like myself, that often entails seeing patients at their post-operative visit, talking about their pathology, showing a picture of what I took out, the path report, talking to them about the negative margins and the fact that now their cancer's gone.
I think the impact of our young-onset colorectal cancer program will be phenomenal. We are one of the few in the Midwest to set up this program, but I think, as I mentioned, our uniqueness really lies in this whole person perspective. So we are thinking about our patient, their family, and their community. So those are the elements that really make this program potentially outstanding, and that's our ultimate goal. It's really to bring what we learned in terms of both prevention, early detection, and treatment back to the community.
It's important to know your family background, to know what types of cancers or illnesses you may be susceptible to. I think it's important that you keep your doctor's appointments, and I think it's important that if you have new symptoms, something that's not usual for you, I think that it's important for you to get those checked out, because early prevention is key. Most cancers are curable or treatable if you catch them early.
When we sit down as a team and talk about what we're doing, what are our plans, the thing that always drives us and drives those conversations is how can we do better by the patients that we're seeing today and make it better so that the patients of tomorrow have better outcomes, have less morbidity, have a better life that they can lead as a result of being here with us.